You're uniquely positioned to give us some data on what exactly is happening in the healthcare industry with staffing, with these medical offices and hospitals.
Yes, hi, good afternoon. Thanks for having me on. So we're seeing an incredible roller coaster ride in the American healthcare system. As you all know, the COVID pandemic really was peaking in late March and early April, and we're seeing that in our own data. And we're an online staffing company, so we help put nurses and doctors on the front line where they are needed for surge capacity, and so we process job orders. We saw a dramatic increase, about a 3 times increase in job orders in that late March, early April period, and about 90% of those COVID-19 job orders have now declined. We're seeing a trickle of job orders now, which I think suggests both that we are kind of past the peak, but also that our healthcare system may have been more appropriately staffed for the need than we had originally anticipated. And across the country, we're seeing this. There's very few hot spots where we're seeing upticks. It's mostly downward trends at the moment.
And when you got that surge in demand, Alexi, how was your supply? In other words, were there the available bodies to fill the jobs when the peak of the crisis was hitting?
Yeah, actually, that was one of the most inspiring things about the whole experience. So in the peak period, we saw a 3 times increase in the number of job orders, but a 4 times increase in the number of clinicians applying to those jobs, and a 10 times increase in the actual number of applications that they were putting in, meaning that people were really raising their hand, volunteering to go to the front line of the battle. And so actually supply was not the constrained resource here, partially because I think there's a nobility of the practice of medicine, but also, our system was able to very quickly scale. We offer higher pay to clinicians and guarantee things like N95 masks and their pay, even if they got quarantined and things like that. So eliminated the sort of concerns and risks. But I think it speaks more to the willingness of the supply side, of the clinicians, to respond to the call.
So, Alexi, what are you facing down the road in terms of court cases and challenges between sort of staff and hospitals and so on? Are you anticipating any sort of difficulties going forward?
Absolutely, and we're already seeing it. I think that there was this initial surge of needs around, addressing the pandemic. And in order to do that, so that's where the entire healthcare staffing industry focused its energy. But the bread and butter is helping hospitals stay staffed for all of the normal things that happen, operating room staffing and endoscopy suites and all these what are called elective procedures. And in fact, they're not just elective procedures. It's just all of the non-urgent but not optional things that need to be done.